introduce yourself, one sentence elevator pitch on what you do, and how is your work differentiated and uniquely making an impact in behavioral health?
Danielle Vaeth with Qbtech. We offer an objective FDA-cleared test for ADHD. ADHD affects 15 million Americans and is both over and underdiagnosed. Our technology really brings those patients closer to a more accurate diagnosis and treatment monitoring through measuring attention, impulsivity, and hyperactivity, which are the core symptoms of ADHD, through a computer-based assessment that is backed by over 40 independent peer-reviewed studies. ADHD, if left untreated, can have devastating consequences, yet the current standard of diagnosis has really been the same since the 60s and is ripe for shakeup. It relies heavily on subjective rating scales, which are filled with bias, and although very critical, can be contradictory. And so when we think about upskilling and really looking at addressing provider shortage in the entire ecosystem for patients with ADHD, we know that clinicians are lacking training. Our data, not just our subjective and objective data, but we also provide clinical support training to really help handle some of the provider shortages. We leverage facial recognition technology and are the only solution that really measures hyperactivity, which is a biomarker, and often overlaps with other conditions. And it's typically the first to respond to treatment. We produce a comparative report that's highly visual, that is easy to read by both the clinician and the patients, and can be addressing both complex cases as well as treatment response. When we look at those reports, and adding in our technology, we're reducing wait times by over 30%. We show an increase of clinician and patient confidence between 88 and 93%. And we know that that then can lead to less seeking of second opinions, for instance. And we're also able to monitor treatment. Our objective data serves as a safeguard for prescribing, which is especially crucial given the scrutiny around Schedule II medications commonly used in ADHD treatment. I will just roll right in. The populations that we're treating, ADHD is something that I love advocating for, and it's not just something that's in kids. There's a 400% increase in adults with ADHD concerns, yet the existing provider shortage is even smaller for those who are willing to address this condition. One clinician supervisor shared with me the anxiety around treating ADHD in adults is palpable, which is why they actually address and adopt our technology. We're able to improve and leverage data through a standardization of care, which is vital in improving outcomes and really setting a new standard. Our current technology is utilized by thousands of clinicians across 46 states in the US, and it's also internationally in 12 countries. From a scale perspective, we are doing work in the UK with the National Health Service, where we are used in 80% of clinics assessing ADHD. And really, what we're looking forward to in the next 12 months is to leveraging what we know, right? So we've just tested our 1 millionth patient, and although this took some time, we expect to get to another 500,000 by the end of 2025. And over the next 12 months, we're really focused on using and advancing our technology, our evidence base, and our outcomes for success to do so at scale. This year in the US, we're expanding our partnerships with health systems, virtual care delivery models, and payer in a school, hopefully, to mirror and broaden what we've already demonstrated in the NHS in those improved outcomes.
I think we all have seen that this category has been tricky for a lot of reasons. It's a very tough one from a regulatory perspective. It's very easy to do something that kind of runs afoul of I think in some cases the FTC and other agencies where we've recently kind of seen a lot of this play out. So what are you all doing to ensure that you are providing that convenience and ease of use that's so important to your patients, while also having really strong kind of clinical independence and making sure your clinical teams feel that they can administer the type of care that they see fit, and then managing the expectations of VCs at the same time?
I think I would add to that because it's absolutely right. You have to have the clinician and the patient experience. Being a medical device, we're FDA cleared and ISO, and it takes a tremendous amount of manpower and investment from an organizational perspective to do that, and have the outcomes data. And and thinking through, I think one of the things that we can work together on is really thinking about how are we going to measure outcomes, not just from a technology perspective, but from a systems of care perspective. And so that's really where we're trying to focus on is looking at not just the smaller improvements, but the overall population improvements. And I think taking some point solutions and some larger solutions together will be able to do that.
Do you think AI is overhyped, underhyped, just hyped enough when it comes to, you know, your particular category or company?
We know that patients self-report. We can actually identify 50% more accurately if someone's responding to treatment than by self-report alone. But that doesn't actually remove how the person is feeling, right? That is just as important and why they're feeling that way. It gives the clinician the opportunity to look at the objective data and ask and look at what is actually not lining up. So I think there's ways to use both.